This is HealthCall Online, the place for extended versions of interviews you hear on our weekly radio broadcast, the HealthCall Radio Hour, now heard on more stations around the country as they join the HealthCall Radio Network. Our focus today, a new report that claims common vaccinations for adulthood conditions may actually be helping protect you from Alzheimer's disease. Now, that is a really big deal that deserves a closer look. So I'm happy today to connect with Dr. Paul Schulz to get a better understanding of his research. He is professor of neurology and the director of Neurocognitive Disorders Center at UTHealth in Houston. He is also the senior author of the published paper in the Journal of Alzheimer's Disease, asserting that if you've been vaccinated against tetanus, shingles, and a certain form of pneumonia, you may have a measure of protection against Alzheimer's. So that's some really great news, doctor. Let's get the main answer out of the way first. If you're a guy like me with gray hair and piling on the years, how much protection are these vaccines likely to confer?
Yeah, for each one it's slightly different, but yeah, somewhere between 20 and 40%, depending on the vaccine and how many times you've been vaccinated.
That's significant. So is that additive? So if I have all of them, do I have a greater degree of protection, or just one will confer that amount?
So we did them one at a time to see if there was an effect. And to be honest, I was thinking we weren't going to find anything, or we were going to find the opposite. So we did one at a time. And now we're at the point where we're going to look at to see whether two vaccines are better than one. But we do know that for each vaccine, the more times you get it, the more protected you are.
Oh, okay. That's great. So does this indicate that I should have, is there an annual schedule for this? Is it every 3 years, 5 years? How do I talk to my doctor about the reason I want an updated tetanus shot, for example?
Right. Yeah. Tetanus, of course, is like every 10 years. So honestly, it's kind of surprising we found an effect because it's so far in between the injections. With the influenza virus, people typically get the flu vaccine around this time of year every year. And we were able to show that 3 years in a row reduced the risk of Alzheimer's about 20%. 6 years in a row reduced it about 40% over the next 8 years. Now, we don't know if it's forever because we haven't followed people forever, but at least for 8 years, it's a very significant reduction in the risk of getting Alzheimer's.
Yeah, sure. So the latest of these vaccines to have come out is the shingles vaccine. I think the Shingrix series is probably the newest among these. What impact does it have?
So all four of them that we've talked about have two really big effects. One is we don't get that disease,
Mm-hmm.
and the other is something on Alzheimer's. It turns out that in Alzheimer's, in the brain, there's a lot of inflammation going on. It's as though there's a fight going on up there between the immune system and the amyloid plaques that you've probably heard about. And anything that raises inflammation in our body is not very good for my patients with Alzheimer's. So when they get the flu, when they get a urinary tract infection, break a bone, the inflammation elsewhere in the body affects the brain. So the first point is that by avoiding getting the flu and the shingles and so forth, we're avoiding the inflammation that often accelerates the amyloid pathology. And then the second thing is separate from that, when we control for the number of times people actually got the illnesses to the best that we can, it still appears that the vaccine has a different effect on reducing the risk of Alzheimer's, perhaps through another immune mechanism.
Oh, so it's doing something to the immune system to help fight back against the amyloid plaque and the tau protein tangle?
Exactly. Around those plaques, by the way, Lee, there are inflammatory cells in every plaque that you look at in the brain. If someone has a biopsy or passes away and you look, you see the amyloid plaques everywhere, and around them you'll see these inflammatory cells. In fact, we think that those inflammatory cells are why brain cells actually eventually don't work and why they may actually die. And that is because the inflammatory cell's job is to say, well, there's a bacteria that came into my brain or a virus or whatever, and they attack it and they release a bunch of poisons to kill it and then eat it. And if you lose a few brain cells in the process, it's worth it because we're still alive and the majority of our brain still works. But in this case, the amyloid plaques accumulate in the brain for 10 to 20 years before the first symptom of Alzheimer's. That means that at some point during those 20 years, the immune system starts to recognize the plaques as foreign and starts to attack them. And it does what it's supposed to do. It releases a lot of poisons to get rid of this foreign substance, which it can't get rid of because it's not a bacteria you can eat. It's a plaque that's very large compared to the cells and very inert, very chemically sticky. You can't break it apart easily. And so for 10 to 20 years, they're releasing poisons. And if you look around the plaques, you'll see that all the brain cells around it have disappeared. And we think it's because the immune system is accidentally killing a few to get rid of a bacteria. In this case, it's killing thousands accidentally over 20 years to try to get rid of the plaque. So as you can imagine, then, anything that affects the immune system could have a big impact on the risk of getting Alzheimer's and on how fast it progresses and so forth.
So that's kind of like collateral damage from a hand grenade. You're hitting lots of things besides the target.
Right, right. I don't like to be violent, but yes, hand grenade would be a good analogy. Yes, it's supposed to get one thing out there, person, whatever, and it can do a lot of other things. That's exactly right.
Yeah.
Good analogy.
So we are talking here about neuroinflammation. And I keep hearing that phrase over and over again in relation to Alzheimer's and other conditions as well. Is
Yeah.
there anything I can do from a lifestyle standpoint in addition to the vaccines, which of course are just a good idea because who wants shingles, right? Um,
Oh, yeah. No,
but
there's a
besides,
lot of things you can do. Yeah, we think that, different studies have shown between a 20 and an 80% reduction in Alzheimer's with lifestyle changes alone. And so most of us in the field say, well, 50% is the average, and that's a pretty good guess. Uh, yeah, it turns out that physical exercise, mental exercise, lowering your cholesterol, lowering your triglycerides, that's the fat in your blood, lowering your blood pressure, lowering your sugar, and a whole host of things like that have a significant reduction on it. It's kind of interesting, actually, if you look at like the short-term memory area of the brain, which is really sensitive to Alzheimer's, it'll actually be larger in the animal models where the animal exercises more than its litter mates, so to speak. So yeah, there's a direct effect on the brain areas involved in Alzheimer's, and we think that those kinds of things go on in terms of preventing it. The one question I think you're kind of asking, which I don't think we know the answer to yet, is there's a lot of foods that we talk about as being anti-inflammatory.
mm-hmm.
And it's been tough to show that they directly affect the risk of Alzheimer's, but indirectly they certainly do. We know that how you eat affects your cholesterol and your blood sugar and all the things I mentioned that are risk factors. So diet is certainly one of the important lifestyle factors. Yeah, so not to, pick anybody out, but too many burgers at such and such a place with a milkshake and fries, probably not a good lifestyle decision to prevent Alzheimer's. Probably goes the opposite direction.
Yeah, so people may have heard of the MIND diet as having lots of foods that are rich in these natural anti-inflammatories.
Uh-huh.
You're a supporter of that then? I should follow the MIND diet?
Well, I don't know the mind one per se, but there are certainly a lot of, so-called healthy or heart healthy diets. The heart healthy diet is very similar to the brain healthy. It's all the same things that we know affect the risk of heart attack, also affect the risk of Alzheimer's disease. Yeah, so I don't know that there's a particular one to recommend, as opposed to, as long as you're on the healthy side, you're way ahead of, those on the other side, so to speak.
So recently, the FDA approved sort of a new family of medications designed to specifically attack Alzheimer's. The first that are in this family, they're monoclonal antibodies designed to go right after that beta amyloid plaque that we've been discussing. What's your experience with these? Are you seeing results?
Oh my God, Lee, this is such an exciting time to be in Alzheimer's. I mean, honestly, for decades, when I would see someone and diagnose them, it was sad for them. It was sad for me. We did studies for years, but I got a lot of gray hair because none of them were positive. No, these antibodies now are having a genuine effect that it's obvious when you give it to people. It doesn't cure it yet. Between a third and 60% slowing, depending on the antibody and the stage they're at. It is ironic, too, because we just spent 10 minutes talking about inflammation being bad for Alzheimer's. But this is a case where we've kind of taken over, subverted, or taken advantage of things that we know about that honestly, again, all of us had a lot of trepidation about in the beginning. But what I'm getting at is that we are actually causing inflammation in the brain. We're giving antibodies that attach to a plaque, and then the white blood cells come in and there's inflammation. And it could have gone the other way, because we just talked about how inflammation can really accelerate things. But in this case, the unique feature is that by having an antibody attached to the plaque, the white blood cells see that, and whenever they see an antibody attached to something, they literally rip it apart. And so after 6 to 12 months, or 18 months, depending on the drug and all, we can remove all of the visible plaques from the brain. I mean, this is an incredible deal, because these plaques are inert, they're sticky, they're large. There's all kinds of reasons why this shouldn't have worked. But thank goodness, it literally will do an amyloid PET scan on someone, see, millions of plaques in the brain, put them on the treatment, and by 6 months, with different drugs, about 30 to 40% will have a negative scan, like 6 treatments, and suddenly the scan is negative. And then by a year and 18 months, another 30 to 60% will have a negative scan. And that has an effect then on the clinical course of things. Of course, if we got rid of them and didn't affect people clinically, it wouldn't be any good. But sure enough, people progress more slowly. So very exciting. And I think the most exciting part about it, Lee, is that we're now doing the same kinds of studies in people before they have symptoms. And I'm mentioning that because one of our hypotheses in the field, not just me, is that the reason that we slow things but don't stop it yet in people with early Alzheimer's is the disease has been going on for 10 to 20 years before we see them. And so what we're doing is, working backwards and saying, hey, what if we start 5 years before the first symptom and remove the amyloid then? Maybe the downstream effects would be turned off also, and maybe we'd be more successful.
Fascinating. The challenge I see here is one of cost, right? I mean, the PET scans and identifying people early, the economics just don't play out to allow us to do that at scale yet.
It's tough. I broke a spoke on my bike and needed a new tire this weekend. And the guy said, I've got a new rim and all. And I said, is it going to cost me an arm and a leg? He said, no, only an arm. I said, okay, that's a good price. It's very similar here. You're absolutely right. It's an arm and a leg. But then when you hear it's only an arm, it's not so bad. No, it's very expensive. I wish it was cheap. I hope to God we can give it to everybody eventually who needs it. There's probably 1.5 million plus or minus Americans who are in the early stages of Alzheimer's who could benefit from these drugs. And whether or not we've got the ability to give it to that many people, I don't know. I hope to God we do. I hope there's some meeting of the minds between the pharmaceutical companies that make them and us that need them, and us that see patients in clinic every day that need them. And and who knows how this is going to happen, but I just hope that we can give it to everybody, because it really makes a big difference. Huge impact on quality of life of our patients, huge impact on their loved ones. Can you imagine how hard it is to watch your loved one slowly change and eventually forget who you are and all that kind of stuff?
Doctor, we're going through that right now. Yeah, we're going through that right now with my mother-in-law. We saw it with my father-in-law. So this is something that I understand quite well.
Oh, yeah.
The most exciting thing out there, although I have to say the research on it I'm still not very clear on, is some early designation of a breakthrough status for an actual vaccine against dementia. Can you fill me in on anything there?
Yeah, no, that's a really good question. So it's coming around. So 30 years ago, the first time we tried the antibody approach, we thought, well, we'll vaccinate someone against amyloid. They'll make their own antibodies and that may clear up. But it turns out that when you immunize someone, it's a problem for the following reason. The amyloid plaque comes from a normal brain protein, and it's hard to get an antibody through a vaccine that's only against what you want, which is the fragment that forms the plaques. And instead, all of your brain cells have this protein. And so in the first trial about literally 31 years ago, 6 out of 360 patients got terrible inflammation in the brain. And we couldn't turn it off because they were vaccinated.
Mhm.
And sometimes after months or years, the immune system, quiets down. But it was terrible. So we switched to passive immunization, meaning we make the antibodies in the lab and give them to people monthly as an infusion. That's why we have to keep treating people and why it's expensive, because we don't want to take a chance on actively immunizing. Now, what's happening, Lee, is that the immunologists who know a lot more about immunology than I do and who are smart have figured out that you can change how strong the vaccine is and what it reacts against and how likely it is to cause terrible inflammation. And so at this time, there are groups around the world trying, again, active vaccination. Because you could imagine if you got one shot and it took care of it, what would that cost? $100 or something like that, or whatever the flu vaccine is. I have no idea.
Right.
Rather than coming in every month for $1,000 worth of antibodies, doesn't look like a lot, but to make that in the lab is very expensive. So yeah, really good question. I think eventually active immunization is going to be where it's at. We just have to verify that it's safe to do that and that nobody gets a terrible inflammatory response that we can't control.
Let's bring this back around to where we started and talk about those common vaccines. In case somebody joined us late, I want to recap just for a second there. So your recommendation is to have a flu vaccine every year, as is the case. I mean, that's kind of the general recommendation anyway.
Yes.
And then how often can I have a Shingrix vaccine?
Well, the Shingrix is usually just a 2-shot deal. I mean, it's quite effective. Again, the surprising thing is the two shots caused enough of a change that we could detect it in looking at a large population. Thank goodness. I don't think there's any recommendation to get more than 2, from the people who specialize in those vaccines. But even those 2 reduce the risk 20 or 30%. And the same with the Tdap, the tetanus one, and the same with the pneumococcus, which is against the bacteria, of course. And of course, with the influenza, by getting 6 of them annually, no more than recommended, but no less either, about a 40% reduction. We don't know if 6 or 10 vaccines is going to do even more, but at least at this time we got a good rationale for studying the vaccination effects on the risk of Alzheimer's further. In fact, now we're looking in the animal model. We can give mice Alzheimer's disease, and we can control a lot of factors on them. So we can vaccinate them and study how this occurs and so forth, and maybe do an easier way of putting it into effect, so to speak. And the nice thing about the mice is they don't complain about the chow. They don't want to go out for a steak and introduce all kinds of variables. When we study humans, there's all kinds of, we all do things differently. The mice never complain. They all get on their wheel and run every day, and they eat the same stuff, and everybody in the room eats the same stuff. So we can get rid of a lot of variables to figure out what's going on here.
And there aren't many mouse lawyers out there to come back and sue you later, so that works in their favor too, right? So I love to ask
True
docs
enough.
like you, guys who study this. Tell me about your life. How do you live? What habits have you adopted based on everything you've learned and all your research and everything you've seen?
Oh my God, that's a really good question. No one's ever asked me that before. Yeah, I jogged 6 miles this morning, and I do that a few days a week with friends. So it's fun. But yeah, the idea of exercise physically, as I mentioned, I follow that. My wife and I try as hard as we can to eat properly, low fat, low cholesterol, all that kind of stuff. Yeah, I do try to implement all those things. We all cheat once in a while, but for the most part, we try really hard to follow what we're saying. Yeah, I bike to work, and on a day like today when it's raining, patients will find out that I biked here or something because I come in with my hair muffed. And I tell them, well, listen, I really do try to practice what I preach to you. I hope you would consider following the same suggestions for exercise and diet and so forth, along with all the medicines we give you and all that too. But
Yeah.
start with the basics here that everybody can modify.
Have you seen a supplement or anything else that has a measurable impact that makes it meaningful enough that it needs to be on my radar screen?
That's a toughie. The challenge is that it's tough to study them, and the finances aren't out there for it. So the honest truth, every day people come in and say, well, I heard about turmeric, I heard about this. The honest truth is I don't know one way or the other if they're helpful. I'm not going to get a grant to study turmeric, from NIH.
Right.
And so we'll never know if it works or not. So I tell people, as long as it doesn't cause any problems with the other meds we give you, I come from a whole family of people who have beliefs about supplements and all that, and so go for it. But I can't tell you for sure if they're helping or not.
Okay. Last thoughts? Anything you want to leave us with?
I'll just say, my mom's mom died of multiple sclerosis in around 1966 when I was 7. And that had a huge impact on me, like you're talking about your mother-in-law there. Seeing that and knowing at that time we couldn't do a darn thing about MS got me into healthcare and into research because I thought, I've got a brain, God-given, whatever, I should use it. And could you imagine every little thing that each of us in the area does has, to have an impact on people. 60 years after my grandmother passed away, we're at a point now where we're actually having an impact on a disease that has been intractable as long as there's been humans on this earth. And the same with my colleagues who do MS. I ended up not going into that area, though I understand it and I think it's fascinating. But thank goodness we live in an era now where we're actually having an impact on people's lives who are suffering from really the most emotionally wrenching disease that there is, and that is Alzheimer's disease.
I can totally agree with you on that. Thank you so much. I really enjoyed talking to you. That is Dr. Paul Schulz. He is professor of neurology and the director of Neurocognitive Disorder Center at UTHealth in Houston. Again, Paul, thank you so much.